Your period hasn't come in months. Or maybe you get a period every few weeks with no pattern. Something feels off. What if you're not ovulating? What does that mean for your body? Today, we're exploring anovulation, what it is, why it happens, and what to do. Anovulation means your ovaries aren't releasing an egg. Ovulation is your menstrual cycle's central process. Without it, everything changes. Your hormones don't follow their normal pattern. Your uterine lining doesn't build and shed normally. Your period doesn't come on schedule, or doesn't come. Important. Anovulation isn't an abnormality for other people. It's quite common. Many women experience anovulatory cycles, sometimes one, sometimes months. Some experience chronic anovulation, rarely or never ovulating. This happens for various reasons. Your hypothalamus releases GnRH, triggering your pituitary gland to release FSH. FSH wakes up your ovaries, which develop follicles and produce estrogen. When estrogen reaches threshold, your pituitary releases LH, triggering ovulation. Your ovary releases an egg. After ovulation, the empty follicle becomes the corpus luteum, producing progesterone. Progesterone prepares your uterine lining for potential fertilization. If fertilization doesn't occur, progesterone drops, triggering menstruation. An ovulation happens when something interrupts this chain. FSH might not rise, follicles might not develop, estrogen might not reach threshold, the LH surge might not happen. Any break in this chain stops ovulation. Balam kamin yokara there. An ovulation has multiple causes. Polycystic ovary syndrome, PCOS, is one of the most common causes. PCOS disrupts hormone balance, preventing normal ovulation. Women with PCOS often have irregular or completely absent periods. Thyroid disease is another very common cause. Your thyroid hormone affects your entire endocrine system, including reproductive hormones. Low thyroid function can stop ovulation entirely. Warming the extreme exercise or severe calorie restriction causes anovulation. Your body interprets these as survival threats. It stops non-essential functions like reproduction. This is called hypothalamic amenorrhea. Your brain literally shuts down ovulation. Stress causes anovulation too. Chronic stress elevates cortisol, which suppresses reproductive hormones significantly. Warming CDNMLON, the nilinom them. Did these hanat name them sooning sags? These unusual. Imindinum namp. Duns feminis kamagindings. 2 meal means umninsandi means a mider. Fridiandum simendum. Your body needs adequate nutrition to ovulate. Without it, ovulation stops. Age affects ovulation too. As women approach menopause, anovulation becomes increasingly common. Premature ovarian insufficiency, where ovaries stop working before age 40, causes anovulation. Hormonal contraception prevents ovulation by design. When you stop the pill, ovulation usually returns, but it takes time. Certain medications affect ovulation. Antipsychotics, antidepressants, and other drugs can interfere. Prolactin disorders cause anovulation. High prolactin suppresses reproductive hormones. Hypopituitarism, pituitary dysfunction, stops ovulation. Multiple causes exist. The most obvious sign is missing periods, amenorrhea. If you haven't had a period for 3 months or more, ovulation might be stopping or absent. Irregular periods are another significant sign. If your cycle is unpredictable, sometimes 21 days, sometimes 60 days, an ovulation might be occurring. Light periods can indicate an ovulation. Without the hormonal surge of ovulation, your uterine lining doesn't build much. Some women have periods but no ovulation. This is anovulatory bleeding. Your uterine lining sheds, but not in response to normal hormonal cycling. You might experience absence of typical cycle symptoms, no temperature shift, no cervical mucus changes, no Mittelschmerz pain. Your body simply isn't cycling hormonally. Some anovulatory cycles have no external signs. You think you're ovulating when you're not. Tracking ovulation through temperature, cervical mucus, or ovulation tests might reveal no ovulation actually happening. These signs matter because they help identify the problem early. Without ovulation, your cycle changes dramatically. Without the LH surge triggering ovulation, FSH stays elevated. Your ovaries keep developing follicles but never releasing them. You might experience prolonged periods of high estrogen levels. Your uterine lining builds but doesn't fully mature normally. Instead of normal period shedding, you might have irregular, sometimes heavy breakthrough bleeding. Bronte or reblis symptom def. Visig robulation, widith minudu, one and gidamil, han retconsemd, voiken stomboims and nukenschornhund. Disi pumdum shevel ninshum, progesterone prepares the lining for shedding. Without it, shedding is chaotic and unpredictable. You might get a period, then not get one for months, then heavy bleeding suddenly. The pattern is unpredictable. Brumpi or brumtumd. Defende btb. The pattern is unpredictable. Brumpi or stumdef. Ananda multumd. Homestab meaning kidimin wanja in the stoinger. Jumonum meaning igonim kidimin winu. Brumben in pidaning microfo. Without progesterone balancing it, estrogen continuously stimulates your uterine lining. This can cause endometrial hyperplasia, thickened uterine lining. If continued unchecked, it increases endometrial cancer risk. This is why anovulation isn't just inconvenient, it has real health implications worth addressing. The most obvious fertility impact. You cannot become pregnant without ovulation. No egg means no fertilization is possible. If you want to become pregnant and you're not ovulating, this is a significant barrier. However, and this is critical, anovulation doesn't mean permanent infertility. Many causes of anovulation are highly treatable. When the underlying cause is addressed, ovulation often resumes. If you've been trying to conceive without success and you suspect anovulation, medical evaluation is essential and important. Blood tests can check hormone levels comprehensively. Ultrasound can visualize your ovaries directly. These tests help identify why ovulation isn't happening. Once identified correctly, treatment can often restore ovulation. Some causes of anovulation, like PCOS, require ongoing management, but even with PCOS, fertility is possible with appropriate treatment. Other causes, like hypothyroidism, are very treatable. Thyroid hormone replacement restores ovulation. Extreme exercise or calorie restriction causing anovulation can be reversed by changing behaviors. The point: anovulation is often fixable. PCOS, polycystic ovary syndrome, is a common endocrine disorder causing anovulation. Women with PCOS have insulin resistance and elevated androgen hormones, preventing normal ovulation. PCOS is manageable with medication and lifestyle changes. Thyroid disease causes anovulation. Both hypothyroidism, low thyroid, and hyperthyroidism, high thyroid, can disrupt ovulation significantly. Thyroid hormone replacement or treatment restores ovulation. Premature ovarian insufficiency, POI, means your ovaries stop working before age 40. This causes anovulation and early menopause symptoms. POI is less commonly reversible, but hormone therapy can help. Hypothalamic amenorrhea, where extreme stress, exercise, or weight loss causes your brain to shut down ovulation, is actually reversible. Addressing the underlying cause restores ovulation. Hyperprolactinemia, elevated prolactin, suppresses reproductive hormones. Treating the cause lowers prolactin and restores ovulation. Hypopituitarism, pituitary dysfunction, stops hormone production. This requires hormone replacement therapy. Eating disorders cause anovulation through malnutrition. Treating the eating disorder and restoring nutrition restores ovulation. Each condition has different implications. The menstrual cycle happens to many women occasionally. Stress, illness, or extreme exercise might cause you to skip ovulation 1 month. Your next cycle resumes normal ovulation. This is temporary and usually not concerning. However, if you have several anovulatory cycles in a row, or if your cycles are consistently anovulatory, this is chronic anovulation, requiring investigation. Temporary anovulation happens occasionally. Cycle resumes within 1 to 3 months. No concerning symptoms. Chronic anovulation happens repeatedly. Cycle doesn't resume normal pattern. Might have associated symptoms. The difference determines whether simple monitoring is enough or whether medical evaluation is needed. Some women naturally have longer cycles with infrequent ovulation, and this might be their normal. Others are truly anovulatory. Understanding which applies to you requires tracking and possibly medical testing. If you previously had regular cycles and they've suddenly become irregular or absent, that's significant. If your cycles have always been unpredictable, it's still worth investigating, but the urgency differs. Definitely see a doctor if your periods have been absent for 3 months or more. Amenorrhea lasting this long warrants proper investigation. See a doctor if your previously regular cycles become irregular suddenly. If your cycles have always been unpredictable, seeing a doctor still helps identify whether this is normal variation or something requiring treatment. See a doctor if you're trying to conceive and haven't been successful after trying for a year, or 6 months if you're over 35. See a doctor if you have signs suggesting anovulation alongside other symptoms, weight changes, fatigue, hair loss, or acne. These might indicate PCOS or thyroid disease specifically. See a doctor if you're experiencing heavy, irregular bleeding. This might indicate anovulatory cycling and uterine lining buildup. See a doctor if you have severe cramping or pain despite anovulation symptoms. See a doctor if you simply feel something is wrong with your cycle. Your intuition matters. If something feels off, professional evaluation is appropriate and worth pursuing. Forced novulation is very common. You're not broken. Your body is responding intelligently to something: stress, weight, exercise, medical conditions, or other factors. These are identifiable and often manageable. Second, anovulation is often highly treatable. Depending on the cause, treatment can restore ovulation and normal cycling completely. Third, even if you have a condition causing chronic anovulation like PCOS, this doesn't mean you can't become pregnant. Many women with PCOS conceive successfully. Pregnancy is possible with appropriate treatment. Fourth, anovulation doesn't develop overnight usually. Most causes are gradual, giving you time to identify and address them. Fifth, tracking your cycle provides valuable information. Understanding whether you're likely ovulating helps you advocate for your health with doctors. You don't need expensive tests initially. Observing your cycle gives meaningful clues. Temperature tracking, cervical mucus observation, and period patterns all provide helpful information about ovulation. Your menstrual cycle is important feedback about your overall health. When your cycle changes, periods disappearing, becoming irregular, or changing in flow, your body is communicating something very important. Anovulation is one possible message. The message might be: stress level is too high, weight change is too extreme, exercise is excessive, or an underlying medical condition needs professional attention. Understanding why you're not ovulating is the first critical step to addressing it. This clear understanding comes from paying attention to your body, tracking your cycle carefully, and consulting with healthcare providers. Your cycle is a vital sign, as important as heart rate or blood pressure. Changes absolutely deserve attention and investigation. Understanding your body is the first step to protecting it. Important medical disclaimer: this content is educational and does not replace professional medical advice, diagnosis, or treatment. If you're experiencing irregular periods or anovulation, consult with a qualified healthcare provider.